Hello everyone, here we are again with a new video, and this time we will be talking about coping. Well, let's start out by defining some important concepts. Coping is the usage of cognitive and behavioral strategies to manage the demands of a situation when these are praised as taxing or exceeding one's resources, or to reduce the negative emotions and conflict caused by stress. Everyone has a coping potential. This is an individual's evaluation of the prospects of successfully managing environmental demands or personal commitments. Coping potential differs from coping in that it deals with the prospects of successful management rather than with actual deployment of resources. Someone's coping style is the characteristic way an individual has to confront and deal with stress, anxiety-provoking situations, or emergencies. A coping mechanism can be any conscious or non-conscious adjustment or adaptation that decreases tension and anxiety in a stressful experience or situation. And what we do in therapy is modify maladaptive coping mechanisms to turn them into adaptive coping mechanisms. Coping strategy is an action or a series of actions or a thought process used in meeting a stressful or unpleasant situation or in modifying one's reaction to such a situation. So coping strategies typically involve a conscious and direct approach to problems in contrast to defense mechanisms. And coping behavior is a characteristic and often automatic action or set of actions taken to deal with stressful or threatening situations. Coping behaviors can be both adaptive or maladaptive. And of course, what we want to do is promote the adaptive ones. Everyone is able to train their coping skills and improve. To do that, we have therapeutic and educational interventions that can increase an individual's ability to manage a variety of situations that are stressful and that are often uncomfortable, and sometimes render us really unable to move past that point in time, and it really can create this sense of dread, anxiety, or panic. Of course, these situations can be something a bit more common, like taking a test or even going through a divorce, which I would say it's on a higher level of stress. And then we also have, diagnosed disorders like phobias that are a bit more challenging. The types of skills taught in therapy are tailored to the situation and to the person that we have in front of us, and can involve increasing cognitive, behavioral, and affective proficiencies that people already have and exercising new ones. Now let's talk about different types of coping. We have emotion-focused coping, we have problem-focused coping, and we have avoidance-focused coping. Let's start with the first one, which is an emotion-oriented coping style that attempts to diminish stressful reactions to difficult or anxiety-provoking events through emotional responses such as self-blaming, feeling angry, self-preoccupation, and we try to acknowledge that this emotion is occurring, and then we try to regulate any reaction that we deem negative or something that we just don't want and we don't like. And we do this acknowledgement and managing rather than taking direct action to change the stressor or trigger itself. And the individual tries to control their feelings, and we have a variety of tools to do that. I actually prefer, instead of controlling feelings, I prefer to use the word acknowledging the feelings and then trying to listen to them, understand what they are communicating to us, and then try and work with them rather than, trying to shut them down, because that's not going to work. Then we have problem-focused coping, which is a task-oriented coping style that again tries to help in stressful situations, but this time it attempts to alter the stressful situation itself. So we have active efforts to solve the problem or reduce the negative impact that it has. We want to directly confront the stressor to decrease or eliminate what's happening, and we aren't trying to shy away from the problem. And this involves a variety of forms of instrumental action and problem-solving techniques on, again, different levels. And then we have avoidance-focused coping, and here we try to avoid. It's a technique where we are trying to avoid, ignore, not engage with stressful situations. And we can do this by having, social distractions, other means of escaping. We might directly point our attention to another direction. We can try and, just ignore what's going on rather than actively facing and dealing with it. And we might sometimes feel like this is a coward move, but it can be quite appropriate and useful. It just depends on the problem that we are talking about. Now that we have a better understanding of what coping is, let's take a look at dyadic coping. So let's start by, clarifying some important associations. Psychological problems are affected by coping methods. And sometimes our coping styles, behaviors, and strategies may not be adequate to effectively reduce stress levels and or resolve the problem at hand. Okay? And when we are talking about coping styles, behaviors, and strategies that are not the best, we refer to them as negative coping, or if you want, maladaptive coping. By not attenuating the symptoms of the stress and not alleviating or eliminating the source of said stress, psychological problems get worse. Positive coping styles are related to higher levels of positive cognitive and behavioral adjustments in the face of stressful events, and to a decreased risk of anxiety and depression. This is really important. The higher psychological resilience someone has, the better positive coping style they will then be able to have. And this means that they will be able to handle anxiety-provoking situations and difficult situations in a much better way. So when looking at the coping process in the context of a couple's relationship, we can talk about two different approaches. We have one approach that looks to the individual coping responses to one's stress, and this approach brings attention to the relational context by focusing on whether partners' individual coping responses are mutually supportive and whether the interplay of such strategies is beneficial for each partner and their relationship. And then we have a different approach that moves beyond individual strategies for coping with one's own stress to focus on what partners do or don't do for each other and what they do or don't do together to handle stress. We can talk about different models, okay, that try to explain how coping happens and how it interacts. And recent papers have proposed a model integration of three different models of the relational cultural coping model, the communal coping model, and the relationship-focused model. And how does this integration work? All dyadic coping models support the same core principles about the dyadic coping process. What are these principles? Stress appraisals shape dyadic coping responses. So if we think about the problem as my problem, your problem versus our problem, then it will shape how we will approach, how we not only react to it, but cope with it. Partners communicate about their stress. We have, some studies that explain how communicating about stress can be stressful, but we also have studies that, mention how communicating about stressful situations can help us be more solution-oriented. So the way partners communicate about stress is very important. Sometimes it's not just the fact of whether we communicate or not. It can be how we communicate about it that will impact how we think about it and cope with it. Then partners engage in dyadic coping individual strategies that can help the other partner cope with stress, or in conjoined strategies to handle stress together. As I was saying before, we can have two people who will work individually to solve a common problem, or we can have two people who are going to work together to solve a common problem. Dyadic coping may be positive or negative. Yeah, we've looked at that, and we will look a bit more in depth at what positive and negative coping is. Relationship and contextual factors may affect stress appraisals and dyadic coping. Of course, we have not just social cultural factors, but we have a whole history of how the relationship came to be that will affect how people react. And so dyadic coping models only differ in the attention given to each of these core principles I just mentioned, and the different types of individual and conjoint coping strategies that they describe. An integrated view also includes developmental, relational, and contextual variables as factors that can shape the stress and coping process. This indicates that changes in the stress appraisal and use of dyadic coping strategies may occur depending on developmental variables like the history of the relationship, relational variables like relationship awareness, authenticity, honesty, mutuality, reciprocity, level of intimacy, relationship satisfaction, sexual satisfaction, and ability to resolve conflicts constructively. And also contextual variables like socioeconomic conditions, cultural values, and religious beliefs. Now, if you want to take a look at what a comprehensive conceptual model of dyadic coping dimensions would look like, it would be exactly this. We have total dyadic coping divided into positive dyadic coping and negative dyadic coping. Within positive dyadic coping, we have stress communication, supportive, delegated, and collaborative or common coping. And within the negative dyadic coping, we have controlling, hostile or ambivalent, overprotecting, protective buffering, and uninvolved coping. I think it is important for us to understand what positive and negative dyadic coping mean when we are talking about individual and conjoined coping processes. So individual positive dyadic coping refers to one partner's positive responses to help the other cope with stress. And this includes supportive dyadic coping, empathic responding, delegated dyadic coping, and active engagement. On the other hand, individual negative dyadic coping refers to one partner's negative responses to the other partner's stress, like protective buffering, overprotection, hostile or ambivalent dyadic coping, and controlling dyadic coping. Then conjoined positive dyadic coping refers to what partners do together to cope with shared or dyadic stress, and this includes common, collaborative, communal dyadic coping, and mutual responsiveness. And lastly, conjoined negative dyadic coping refers to partners' conjoined negative responses to deal with a shared or dyadic stress, like common negative dyadic coping and disengaged avoidance. All the dimensions we saw on that image a couple of slides ago, as aggregated dimensions, strongly predict relationship satisfaction regardless of gender, age, relationship length, education level, and nationality. Individual coping and individual dyadic coping are stronger predictors of relationship satisfaction than dyadic coping by each partner alone. Positive forms of dyadic coping taken together predict relationship satisfaction more strongly than the aggregation of all negative dimensions of dyadic coping. And collaborative, supportive, and hostile ambivalent dyadic coping are stronger predictors of relationship satisfaction than delegated dyadic coping, stress communication, overprotection, and protective buffering. And now let's take a look at dyadic coping in the face of fertility-related issues. As you've probably understood by now, dyadic coping is an interpersonal process. And one partner's appraisal of stress is communicated to the other partner, whether this partner is intending to communicate or not. And the other partner perceives, interprets, and decodes these signals and responds with some form of dyadic coping, which might involve either acting on or not acting on the stress communication. Effective dyadic coping includes an activity or process that is able to reduce stress, enhance marital adjustment, promote psychological well-being and quality of life. Infertility can be characterized as a situation of dyadic stress because the demands and changes related to the reproductive period can have a profound impact on women and men. Research has demonstrated the importance of dyadic coping for couples' adaptation to stressful medical events. Also, studies show that there's an interdependence between each partner's dyadic coping, with their own dyadic coping influencing their own marital adjustment and the partner's marital adjustment during pregnancy. Now, I want to talk to you about a study called Dyadic Coping, Marital Adjustment, and Quality of Life in Couples During Pregnancy, an actor-partner approach. This is a study that was done with heterosexual couples. And they proposed this interdependence mediational model, where they say that dyadic coping in women will be related to their quality of life, of course, and dyadic coping in men will be related to their quality of life directly. But then we also have two mediations. We have one that says that dyadic coping in women will lead to dyadic adjustment in women, and then that will lead to quality of life in women as well. And the same applies to men. Their dyadic coping will lead to dyadic adjustment and then quality of life. But then we also have that dyadic coping in men will lead to dyadic adjustment in women and also to quality of life in women. And then their dyadic adjustment will also lead to quality of life in women. And the same applies from dyadic coping in women and adjustment to men's dyadic adjustment and quality of life. So basically, what they concluded is that the marital adjustment was not only associated with couples' quality of life, but it was shown to also be a potential mechanism linking dyadic coping to couples' quality of life for both men and women. So dyadic coping leads to marital adjustment and then to the couple's quality of life. When dyadic coping is high, marital adjustment is high, and quality of life is also high. On this study sample, women's quality of life and overall well-being seemed to be more influenced by the way their male partners dealt with stressful situations. Then another study called Examining the Role of Dyadic Coping on the Marital Adjustment of Couples Undergoing ART, which only focused on heterosexual couples going through assisted reproductive technology procedures, proposed another model, saying that female dyadic coping style would influence their own and the couple's adjustment, and the same applying to male dyadic coping styles. But then the female and male dyadic coping styles would influence each other, and from there they would also then have an impact on the female, male, and couple adjustment. And what they concluded is that infertility and fertility treatments contribute to emotional, social, sexual, and relationship issues that can have a negative impact on each partner's well-being and on the couple's relationship, and one's partner's perceptions of dyadic coping affects one's own couple adjustment and vice versa. Infertility is a couple's issue, meaning that, again, it is defined as a dyadic stressor. The ability of the partners to cope with this experience is a result of both individual and relational coping strategies. Both women's and partners' scores on positive dyadic coping styles contribute to a higher marital adjustment. Although for both partners, the actor effect of dyadic coping satisfaction on couple adjustment is significant, the results show that this effect is stronger for women. The satisfaction of being able to face a stressful event together contributes to their marital relationship acquiring a specific centrality for women who are more directly involved in the ART process than their partners and who are more sensitive to the partner's dyadic support. Then the results show a stronger partner effect for men in common dyadic coping. So men's perception of couple adjustment is predicted by the partner's common dyadic coping perception. The ART process mainly involves the woman, at least physically, so men are particularly focused on the well-being of their partner, and making their couple's adjustment is strongly influenced by the woman's perception that the diet is coordinating their strategies. The fact that women feel they are jointly coping with the ART process can make the partner feel more involved and therefore more satisfied with the couple's relationship. The findings about negative coping indicate that men are more satisfied with their relationship if their partners feel empathetically without superficial or ambivalent behaviors supported by them. And the male perception of the relationship is, in this phase, very focused on the needs of the woman who is especially involved in the process of ART, not only at a psychological level, but also at a physical. Couples unable to engage in reciprocal supportive behavior and those unsatisfied with their coping efforts may be more vulnerable whilst undergoing ART treatments. The findings of this study highlighted some differences that indicate specific dynamics within couples facing an ART treatment. So we have here two squares, one about the ability to communicate effectively and another one about effective dyadic coping. We'll start with the ability to communicate effectively. Dyadic coping strategies represent the efforts of both partners to face together critical and stressful experiences, and these contribute to a greater sharing of the feelings and thoughts related to fertility, and in this way to a perceived more similar distress related to this experience. In the study that I'm presenting to you, significant differences existed between women and their male partners for stress communication, both when self and other perceived communication were assessed, as well as efficacy. Especially women perceived themselves as more able to communicate stress to their partners than men, and at the same time, men perceived their partners as more able to communicate stress than themselves. This awareness of men and women, of their competencies, and of their partners highlights a perceptual congruence between the two. And this congruence could be connected to an overall satisfactory couple relationship. These differences in communication become evident in a situation like ART, where women are more or very involved on the physical level and the psychological level, whereas men experience a smaller involvement physically and sometimes psychologically, but not in all cases. It is likely that women experience very intense stress, higher than what men experience in that same moment, but they also can better express and communicate what they are expressing to their partners than their partners would. Then significant differences between women and men in couples were also found in terms of perception of coping efficacy. Men specifically perceived their dyadic coping to be more efficient than women's. And this perception can be associated with differential stress-related consequences of infertility, like women's age as impeding, cultural influences on meanings of motherhood, and ART experiences like traumatic moments between men and women that just don't happen the same way. The ability to manage infertility-related stress as a common problem is linked to better couple adjustment and increased marital adjustment. Partners can face their critical experience together, leaving their problem as a dyadic problem. Then another study that was also ran on a sample of heterosexual couples going through ART, called the association between stressful life events and perceived quality of life among women attending infertility treatments, the moderating role of coping strategies and perceived couples dyadic coping adjustment, stated that we could have a potential double mediating model that states that experiencing a stressful life event can lead to relational resources and then to quality of life. And experiencing a stressful life event can also lead to specific resources that then influences quality of life. So, a positive moderating role is exerted by specific individual and relational resources on the relationship between experiencing a stressful event and having quality of life regarding fertility treatment. A positive moderating role is exerted by the perception of a satisfactory couple's dyadic adjustment on the relationship between experiencing a stressful event and having quality of life regarding fertility treatment. Perceiving a satisfactory and gratifying couple's relationship, the ability to fulfill the needs for consensus, cohesion, security, and emotional involvement can counteract the negative impact of all previous stressful and adverse events considered on perceived levels of quality of life by sharing negative feelings, worry, and tension related to fertility and medical treatments. Then another study that was also ran on heterosexual couples, called The Role of Dyadic Coping on the Marital and Emotional Adjustments of Couples with Infertility, proposes a model that's a bit more complex, and we'll try to break it down as best as we can. It states that there is an indirect effect of the impact of infertility in one's life on dyadic adjustment through man's perceived dyadic coping efforts employed by the self, and women's perceived dyadic coping efforts of the partner. And I'm going to try and highlight here in green the significant relationships, and in red those that are not significant. There is a direct effect of the impact of infertility in one's life on dyadic adjustment in women, but not in men, as you can see here. So this highlights that there is an importance in men's dyadic coping strategies for the marital adjustment of couples and men's emotional adjustment. For men, a higher impact of fertility in their life was associated with lower dyadic coping by oneself, which was associated with lower marital adjustment. Men see infertility as something unexpected that occurred and should be solved or, accepted. Men report that the most distressing effect of infertility was how their wives were affected by it and its subsequent impact on their marital relationship. Men may feel overwhelmed by the stronger emotional responses of their partner to infertility and may feel the urge to help the partner cope with stress to maintain the relationship quality. Men may experience failure through not being the protector and provider of the family because that's socially expected. And the more men perceive themselves as able to help their partners cope with stress and to communicate their own stress, the higher their marital adjustment and the lower stress is. Men's perception of their relationship quality seems to be related to their perception of self-efficacy in helping their partner cope and their ability to communicate and ask for support when stressed. For women, a higher impact of infertility was associated with lower scores of dyadic coping by the partner, which were in turn associated with a lower marital adjustment. Women see infertility as an intolerable situation that affects their self-concept, and treatment is considered their only chance. Women show a greater tendency to look for social support, which may place a greater strain on men to help their partners cope with stress. Women show considerably greater psychological distress than men. And women often reported feelings of frustration because their partners did not really seem affected by infertility and did not communicate about it. Another study that had a sample exclusively of women, called Influencing Factors of Dyadic Coping Among Infertile Women, a path analysis, states that when the individuals provide sufficient dyadic coping support to each other, there's a higher, better, stronger trust, security, and intimacy on both members of the couple. And it also has a positive impact on the relationship between a husband and wife, which is beneficial to the physical and mental health of both of them. The better the relationship between family members, the better the family intimacy and adaptability, which leads to a better family function. And the support of family members, including psychological and financial support, could enhance the confidence of the patients to overcome infertility. The score of dyadic coping of the people with religious beliefs was higher than that of the patients that didn't have religious beliefs, because religious beliefs could potentially be providing spiritual resonance for patients in such a way that they could respond with optimism and gratitude during treatment by reinterpreting what it all meant. Nevertheless, this could create further issues if partners do not have the same beliefs. This study also states that the better the relationship between family members, the better the family intimacy and adaptability, and this leads to a better family function. The support family members, including psychological and financial support, could enhance the confidence of patients to overcome the disease. In infertile women, there's a strong positive correlation between dyadic coping and family cohesion and adaptability. And family cohesion and adaptability are positively correlated with stress communication by the partner, supportive dyadic coping by the partner, and delegated coping by the partner. stress communicating by oneself, supportive dyadic coping by oneself, and delegated dyadic coping by oneself. A good level of dyadic coping plays an important role in maintaining the relationship between the couples. The higher score of positive coping indicates that the couples are more willing to help each other, have a better quality of life, and have higher family cohesion. Then another study called Dyadic Coping and Sexual Well-being in Couples Seeking ART states that individual who perceives that their partner engaged in higher negative dyadic coping reported lower sexual well-being. Perceptions of higher common dyadic coping were associated with higher sexual well-being and fewer infertility-related sexual concerns for men and women. In these cases, infertility is considered a life crisis affecting the couple as a unit. Again, joint involvement in coping, such as mutual commitment, seeking solutions together, and sharing feelings improves the well-being that they experience. Note that perceptions of positive and negative dyadic coping by the partner were not associated with the partner's infertility-related sexual concerns, sexual distress, and sexual dissatisfaction, meaning that there were no partner effects. It is possible that for men who tend to adopt a supportive role in this context, perceiving that one's partner engages in positive strategies to relieve one's stress could help free up more personal resources to adapt themselves to infertility. This allows for more room for positive appraisal and satisfaction with their sexual activities, so men who perceived that their partner engaged in higher positive dyadic coping reported higher sexual satisfaction. In the context of infertility, support from one's partner has been associated with infertility stress reduction, which has been related to higher sexual satisfaction as well. As mentioned before, women appear to be more adversely affected by infertility, reporting more negative consequences on their self-esteem, stress, depression, anxiety, and sexual quality of life. The association between perceptions of positive dyadic coping by the partner and sexual satisfaction was not significant for women, and perceptions of positive dyadic coping by the partner were associated with greater infertility-related sexual concerns for women. It is possible that partners of women whose infertility has a more negative impact on their well-being, including their sexual well-being, feel a greater urge to engage in additional positive dyadic coping strategies to alleviate their partner's stress. This may be associated with negative consequences for women's self-worth, with feelings of guilt, not being enough, not being able to correspond to expectations, and/or experiencing a sense of being a burden, potentially exacerbating their infertility-related stress and lower sexual well-being. And this is the end of our presentation for today. I know it was highly technical, so if you have any comments or questions, please let me know down below in the comments. Thank you.